My name is Tim Yen. I'm one of the Chief GI Fellows here at the University of Colorado. I'm going to talk a little bit about keys to successful bowel prep for a colonoscopy, tips and tricks. You can feel free to stop me if there's any burning questions. Otherwise, we'll also have some time at the end for a Q&A. So kind of outline what makes a good bowel prep. Second, we'll talk about special diets before the bowel prep in preparation for a colonoscopy. Discussion of different preps that are available, including timing, pros and cons, contraindications. Often the GI kind of group, including the physician and the GI nurse, will determine what prep to be used. And then what's a normal response, what's not normal when you drink a bowel prep, any additional considerations, and some tips and tricks for a patient. So what makes for a good bowel prep? Now there is kind of two sides to this. One on that left side in the blue is what the physician or MD kind of thinks is a good prep. And usually it means something that's safe for the patient. And second, something that's efficacious in cleaning the bowel so that we can take a good look during the colonoscopy. This has to balance with what the patient has to undergo and is often described as the worst part of the colonoscopy. And that's how does it taste, essentially, how much you have to drink, and any side effects from the bowel prep that might not be very tolerable. But the overall goal of a bowel prep is to cleanse the bowel so that when we do a colonoscopy, we can find polyps, take those polyps out, and prevent colon cancer down the line. So when I talk about having an efficacious and good bowel prep to clean the bowel, when you have a good bowel prep, essentially it's spick and span, you don't see any stool, and we can see that even a tiny little, couple millimeter polyp. Whereas bad bowel prep, when there's stool inside, that can obscure and cover up polyps that might be hiding. And there's some pictures we actually, when we do our colonoscopy report, we actually report how good that bowel prep is on a scale from excellent down to fair or poor, and as well as whether it's adequate or not for finding polyps. And that determines, when, if we have to repeat a colonoscopy, essentially, so that we can get a good look. And when we do get a good look, some of these polyps can hide, and you can see even just a little bit on a stool can hide these polyps that aren't very large sometimes, but can be pretty significant. And those are all these little red circular objects there. Now on the patient side, as we talked about, there are some factors that play into it, whether it's medical, psychosocial parts of the bowel prep, meaning that you have to take a day off of work, drink this, you can't really eat too much things, and then you're having diarrhea all day. And then they had some pictures from the previous presentation of just what a patient has to go through. Now, in preparation for the prep, you do have to eat a particular diet. For the whole week prior, leading up to the colonoscopy, they should have what we call low residue diet. And that's things that have seeds like strawberries, nuts, popcorn, high fiber foods, including corn. So those are things that they should avoid for that whole week, because those things don't get digested very well, and they can show up in the colon and kind of block the way. Most patients will be asked to stay on the clear liquid diet the day before their colonoscopy. Some patients will ask to do 2 days or more. That's not as common, but we definitely do ask for that sometimes. Those are in cases of when people have diabetes, narcotics, or if their previous colonoscopy did not have an adequate prep or had too much stool in there. And now what consists of a clear liquid diet? It's essentially any liquid that you can see through. So things that are clear liquids for that day prior to colonoscopy include Gatorade, Jello, even though it's not a liquid, but essentially you can see through it. Any sort of broth that you can see through, not bone broth. Soda, black coffee. Things that are not great and not clear liquids are milk, orange juice, chicken noodle soup because it has chunks in it, burgers, meat, etc. We usually ask the patients to avoid red foods or red dyes, if possible, just because it does look a little weird. Um, it stains the colon red. It looks a little different than blood, but it does make our job a little harder during that time. And then after midnight, the night before the colonoscopy, they shouldn't eat or drink anything except for the rest of the prep. Now, in terms of what brands of prep or what prescriptions they get, there are tons and tons of brands up there. The most kind of well-known one is Go Lightly, the big gallon jug things. There's a newer one called Sutab, which patients do like, but I'll go over pros and cons of each. There's also Miralax, which is kind of an over-the-counter off-label, MoviPrep, Suprep, and then OsmoPrep. So what is the best prep? A lot of it depends on what insurance will cover, how much it costs, and whether they have any contraindications. Some of the most common ones are at the top here, those top three here. The 4-liter PEG, that's the Go Lightly, Colite, New Lightly. Those are just different brand names for the same thing. That's relatively cheap for a prep. The cost is $27. Usually it is covered by insurance. And if you drink it correctly, which we'll talk about, it's usually very efficacious in cleansing the bowel. Disadvantage is that it doesn't taste great, and it's a whole gallon. That's 4 liters of liquid to drink. There is a smaller volume, essentially a PEG called MoviPrep. It's a little bit more expensive. It still doesn't taste great, but it is a smaller volume. Then third is Miralax, which has kind of more variable efficacy, mostly because you do have to just buy the bottle of powdered Miralax and then the Gatorade. And so it's not a set, gallon jug or anything like that. Rarely you can get some issues with sodium. It's not FDA approved, but it'll be off-label use, but we do use it quite a bit. It's overall pretty safe. OsmoPrep, you can't use in renal disease, heart disease, liver failure. You can't be on NSAIDs, which are things like Advil, ibuprofen, Aleve, ACE inhibitors like lisinopril. I can't say that I see OsmoPrep quite so much anymore. And then Sutab is one of the newer preps. It's actually a pill. It's just a tablet that you then drink with several glasses of water. People like it a lot because it's just a pill that you have to swallow and dissolves once it, after you swallow it in your stomach. Disadvantages are it's much more expensive than the other preps, not always covered, and then you can't use it in kidney disease. Suprep is another one, and that one you can't use in kidney disease, heart failure, liver failure. So very similar contraindications as OsmoPrep. So what is the process of when we prescribe them this big jug or the Miralax or whatever prep? How do they drink it? Usually, we ask them to drink all of it, regardless of what happens with their bowel movements, anything. Sometimes they'll get other laxatives or other medications in addition to help things along. But there are 3 ways of doing things. The traditional method is where you drink all of it in one go the night before. Then there's split dosing, which is what we'll talk about, is now the standard of care, where you drink half of the bowel prep the night before, and then you drink half of the bowel prep the morning of, several hours before the actual colonoscopy time. Then there's same day prep, very rare, where you drink all of it just the morning of. So as I said, split dosing, where we drink half and half, is now the standard of care. So you usually take however much. If it was to Go Lightly, that's 4 liters. So half of that, you drink 2 liters, sometime between 6 and 9 p.m. in the evening, the night before the colonoscopy. Then you drink the second half 4 to 6 hours before your colonoscopy. So if you have your colonoscopy at 2 p.m., you drink that, to finish that before, 4 to 6 hours before that. The reason why we do this is because it's been shown in several studies that when you split the prep into 2 kind of separate periods of time, the bowel prep is more efficacious in cleaning the colon, and people tend to tolerate it better because they don't have to drink all of it kind of in one go. They don't have as much bloating, nausea. They're able to kind of get it down a little more easily. So how to optimize the prep? Number 1, you pick a safe prep if they have essentially heart, liver, or kidney disease, or are on any of those things like ibuprofen, Aleve, those blood pressure medicines like lisinopril, you should pick something like Miralax or Go Lightly. Pick the prep your patient will do, whether it's cost or whether it's tolerable. If they had something, if they had Go Lightly in the past and they hated it, probably try something else. Sometimes if they can't tolerate it, we can give them nausea medications to get them through kind of drinking that horrible liquid. And of course, adherence to instructions. So making sure they don't eat seeds and nuts and popcorn for that week before, and making sure they're on clear liquids the day before. And then the split dosing. There are some things with expectations from the patient side to know about. Most patients, after they drink after they start drinking the prep, usually within a few hours, they'll start to have diarrhea and some bowel movements. This can vary widely. If it doesn't happen within a few hours, they shouldn't freak out. You can tell them just to keep drinking and things should happen eventually. Sometimes it just takes a little bit of a delay. Common side effects are nausea, bloating, abdominal pain, and discomfort. That's mostly either from the taste or just some cramping from the laxative inducing a lot of diarrhea. Of course, diarrhea is a big side effect. Irritability, fatigue, just from fasting essentially, and having to drink all this is a big complaint. Some common patient questions. I mentioned this before, I'm not having any bowel movements yet. What do I do? You can just tell the patient to be patient. It will work. If they finish all the prep with that split dosing prep and there's no bowel movements, have them call the endoscopy center in the morning. They don't need to call overnight since pharmacies are usually not open to give the patient this anyways overnight. But they can call us in the morning so that we can give them more prep and perhaps reschedule them if we need to. Second, if they're getting nauseous or vomiting from the taste of the prep, usually it's because they're drinking it too quickly. Tell them to just slow it down, take a break for a little bit, start back up when the nausea subsides a little bit. Some people do need medications to get through the nausea, which we can help with. Third, do I have to get up at 3 a.m. to start the second half of my prep? So if your colonoscopy is at 9 a.m., do I have to get up at 3 a.m. to drink it? Unfortunately, yes. Even though this is not ideal, we don't currently have a biologic or physiologic way to time and clean the bowel otherwise. The most important thing is to get a clean colon so that when we do the colonoscopy, we get a good exam and so you don't have to repeat it again within a year. And then do I have to drink it all, even if you're having diarrhea already at baseline, or if they're seeing things are starting to clear up, you still have to drink all of it. So what does good look like? Good prep should look like urine. I've also seen it described as tea, where it's just pale yellowish. You can see through it to the bottom of the toilet bowl. Bad prep is essentially where there's some sort of sediment or it's opaque and you can't see to the bottom of the toilet bowl. Essentially, you imagine similar to clear liquids. If you can read something through it, then it's good to go. If you can't, then they still have to keep drinking more. Other questions are, should I take my other medications? For aspirin, they can continue that. If they're on a blood thinner other than aspirin or an antiplatelet for like heart attack, other than aspirin, tell them to talk to their primary care doctor or talk to us. If they're on diabetes meds, they should talk to the primary care doctor beforehand in terms of when and how much to hold. All the other medications are essentially okay to take. They don't affect our colonoscopy or the sedation or anesthesia. Next is, if I'm diabetic, what do I do if my sugar gets low? They still keep on the clear liquid diet, but they can drink kind of things with sugar inside of it, essentially to get their sugar up. And they should, again, talk to their doctor about what to do with the diabetes meds. They often have to cut it in half or hold some of them just because they're not eating. So this is kind of the summary of tips for colonoscopy bowel prep, in addition to a couple things. One is to have the patient plan ahead of time, follow the instructions, both the bowel prep and the diet. Some people think that drinking the bowel prep through a straw helps reduce the bitter taste. I think this helps bypass a little bit of the tongue so they don't taste it as much. Stay near a bathroom. Chilling it, some people think that it helps a lot with the taste. So just putting it in the fridge and make sure it's ice cold. Making sure you keep hydrated before midnight. So if you're having a lot of diarrhea, it's okay to keep drinking plenty of fluids and to keep yourself hydrated. So entertainments, you don't have to just sit there and have diarrhea all day. You can still do other things at home, watch TV or anything. And then using kind of soft baby wipes to help with kind of the rectal irritation just from all the bowel movements. Some people think warm compresses can help, and I guess low impact exercise. That's all I had for kind of my plan slides. I'm happy to take any questions if anyone has any.
Thank you so much, Dr. Yen. And I'd encourage everyone to put any of their questions in the chat, and we'll also have the opportunity for people to come off mute. And I'd be very curious to hear from some of our navigators on the call, what has worked really well for them with navigating patients through the preparation process, relieving some of that discomfort in going through the process, and really reassuring them about the process and what it means and the value of adequate bowel prep. So I'd encourage everyone to think about some of those tips that have worked really well for you, if there's some of the things that Dr. Yen mentioned or additional things that he did not. And I did want to highlight and give a shout out to all of our navigators who are on the call, as CCSP has seen really strong rates of adequate bowel prep over the years of the program. Before the program started, many of the GI providers that our clinics were partnering with were seeing lower rates of bowel prep from some of those Medicaid and uninsured patients, and with all the work of CCSP navigators, our program's seeing adequate bowel prep around 95% of the time on average, which is excellent. So just wanted to give a strong shout out to all of our navigators who've been working so hard to get their patients prepared for their exams. And Julie in the chat from Value I just said she completed her own colonoscopy 2 weeks ago, and all of those tips truly did help. Yes, we've heard from many of our navigators that some of them have tried either just the prep process or with going through their own colonoscopies. That can really help provide some additional perspective and sharing that personal experience with patients. So thank you, Julie, for sharing that.
Thank you.
Let me just make sure I didn't miss anything else. I'd also love to ask you, Dr. Yen, from all of the information you've shared around the different bowel prep strategies and really supporting patients, if there's any additional tips that you would share that weren't necessarily in the slides, or
Sure.
any pieces of advice you could give to newer navigators who are just starting to support patients with this process.
I guess anecdotally, one of the things we see the most in bowel prep for colonoscopy is the taste, which is unfortunately not something I don't think any bowel prep tastes good so far. I think the companies are trying to make it taste better, Willy Wonka style or whatever. But some things I've heard have helped with some patients are flavorings packets. So I think like Crystal Light makes like a lemon or lemonade thing. Sucking on lemon drops sometimes while you drink it. As long as it's a clear liquid, anything is fine. Meaning that if You put it in, you dissolve it, and you can still read through it and see through it. It's totally fine to use. Again, the red thing is ideal if you don't have anything red in there. But those are the kind of things I've heard that have helped, making sure it's ice cold. Our nurses, when we do a colonoscopy in the hospital for people who are hospitalized, they often will give them the bowel prep with kind of just chilled on the ice. Both the bowel prep and when they drink it, they're drinking it with tons of ice cubes in it. I think it just helps with the tastes, probably. That'd probably be the biggest kind of complaint and intolerance from bowel prep that I hear.
Thank you. And yes, including ice directly can be a great tip for keeping it cold for longer than just having it in the fridge or having it in the freezer for a little while. So that's a great tip. And Andy put in the chat an open-ended question to ask of those joining us today. If you're all clear about the types of bowel prep that your GI center is using, or the docs that you are referring to are using. As a navigator and as Dr. Yan explained in his presentation, there's many different things to consider for the different types of bowel prep, including those different types of contraindications. So I definitely advise you all, if you are not clear about the type of bowel prep your GI center is using, to really get familiar with that. And if you're not sure, ask directly, and they might provide some additional tips to share with your patients.
And also, to that extent, I think it's really important that if you're not clear on what your GI provider or providers are using, understanding and knowing that. And then, one of the things we talk about roles and responsibilities is understanding who's doing that education for those navigators around the bowel prep education. So, in some of our clinic settings, there have been group medical visits where they do bowel prep within the primary care FQ. Some of the groups, the GI groups, really want to handle that themselves. But I think role distinction of who's doing what, so there's not a lot of overlap in making sure that it's done, is key. And Dr. Yan, I have another question for you, but I think Julie has one, Elsa, before I get to my other question.
Okay, we'll have you next. But Julie's question was, why do all patients drink the same amount of bowel prep, even if they are different weights?
That's a very good question. The reason why it's not weight-based dosing is whether or not someone has an adequate bowel prep does not necessarily correlate with their weight or BMI or anything. We can have someone that's, has like a BMI of 45 and versus someone who has BMI 25, and the person with BMI 25 could have worse prep with the exact same amount. There's a lot of factors that play into it. Like I said, mentioned before, some of the people need 2 days of clear liquids. And usually we find that out because they've had a prior colonoscopy where we did it with just the standard 1 day clear liquids, and it just wasn't clean enough. And they said they followed all the directions. And so sometimes it's from prior experience. Things that predispose people to are diabetes, because that affects how fast the colon contracts, essentially. Narcotics, pain meds are very similar in that respect. And there's things that are put in there that can make it inherently very difficult to clean the bowel completely because of constipation. So chronic constipation is a big thing. Cystic fibrosis patients, my assumption is that they're mostly at CU, but cystic fibrosis patients, they need inherently have very, very bad constipation, and it's very, very difficult to purge because everything they have in the colon or GI tract is so thick. So those patients actually get this kind of ridiculous, like sometimes like 4 or 5 days of clear liquid kind of things, because it is that difficult. So that's why it's not weight-based dosing. We kind of, the 1 gallon 4 liter for Go Lightly was just how it was marketed. And when they did trials, it seemed to work for the vast majority of patients. But I think it's also just a simpler way for them to kind of do the directions. You drink 2 liters and 2 liters for patients.
Awesome. Dr. Yan, my question was, a number of the patient navigators and folks that we see, there's, the question about dietary, and I think you went through that. So if someone is a user, kind of a regular user of even clear liquid, counting as like alcohol, that is not recommended. It definitely should be avoided the day or two before colonoscopy. Is that correct?
Yeah, it's not that the issue is not so much with the alcohol, I guess, is clear liquid, but we don't want them to drink alcohol before, since one, they'll be fasting, dehydrated, and two, kind of just avoids the issue of we can't legally give someone anesthesia and consent them for colonoscopy if they're intoxicated, which doesn't happen in the outpatient setting, but it does happen kind of when someone's hospitalized. So that's the reason for it.
Right. So you can't be double sedated going into your colonoscopy.
Yeah, we just can't. Yeah, we can't consent you for.
Yeah.
We can't consent you for anything. And you can't buy a car, I think, legally. I'm sure you can.
If you show up to your colonoscopy with alcohol in your breath, it's not happening. One of my other questions is, we want to also make sure that our navigators and team also think about adverse events, and that's of course after colonoscopy. But if you had to speak to like what patients should be aware of and navigators should be aware of that as it relates to bowel preparation, that are like some big red flags, that this isn't just kind of like normal, what might feel like flu-like symptoms, but like, hey, no, this is a big deal, something's wrong, you should stop and contact someone. What are those hallmarks of that just being kind of over the top, not okay?
The big things are if you can't get out of bed, that's essentially a clear sign that something's wrong, whether it's related to the bowel prep or not. The big adverse effects listed for all those bowel preps, like with heart disease, liver disease, renal disease, with all kind of osmo prep, SUTAB, things like that. The reason why those are there is because those are sometimes more potent, and they can cause shifts in your electrolytes. So your sodium or salt might be low, your potassium might be low, and that's when you can get a variety of symptoms. And those are similar symptoms that anyone should go to the hospital for. Obviously, if you have chest pain, if you're lightheaded and you can't get out of bed, if someone's confused, which is very rare from drinking it. Most of those occur usually when someone gets one of those preps that's kind of riskier, SUTAB, osmo prep, things like that, and they have these comorbidities. It's pretty rare for someone to have Go Lightly, Miralax, Mobi Prep, and have issues, really. We do that in our hospitalized patients and really, really, really sick patients. And for the vast majority of the time, they're actually okay. So it's only that's when I would put my blinkers on, as if they got one of those kind of more unusual, kind of usually more expensive preps.
Okay.
I'd like to give the opportunity for anyone to come off mute if they wanted to share an additional question, but also again wanted to put it out there since for the opportunity for people to learn from one another peer to peer. If you have had any successful tips for if perhaps a patient did not have an adequate prep the first time, and really providing that extra support to guide them towards completing the prep process in a more adequate fashion the second time around.
I guess I can get up on my soapbox a little bit. The reason why we have this program and why the federal government or the world in general, the GI community, emphasizes colonoscopy, the importance of colonoscopy so much, is for screening purposes. So to prevent colon cancer, if you have a normal colonoscopy with an adequate prep, that provides protection against colon cancer in studies sometimes up to 17 years after the colonoscopy. Now we repeat it before then, but it's out of all the tools we have, it can give you truly a clean bill of health for a long, long, long time.
That's a great point. And definitely that that strong prep really allows the gastroenterologist to much better visualize that colon and make sure that they're not missing those polyps, especially those that might be harder to identify. And so sometimes if the prep is fair, I think they still go on with that colonoscopy, but the patient might not be getting as complete or thorough of an exam as they could have with a really strong bowel prep. So that's one of those things that we find really important too and really valuable about that bowel prep process, that as navigators are really helping the rest of their team work at the top of their licensure and supporting those patients and overcoming barriers, that adequate bowel prep is really important for that quality exam and for the GI provider to fully visualize. We got another question from Rebecca. She says most of her patients get prescribed Suprep, and she's wondering the similarity of that prep to other types of prep and any specific considerations for it.
Suprep is one of the more specialized ones that I'll put in the category, similar to Sutab, which is a pill form. Osmoprep, which I personally haven't seen very much anymore. Those are the ones where, and the majority of patients are fine, but if you have significant kidney disease, heart disease, those are the ones to watch out for, because of the just how strong it is, and it can cause those shifts in sodium and other electrolytes, and so that's where they can get really fatigued all of a sudden, just because of how potent it is.
Thank you, Dr. Yen. All right, just going to do one more round to see if anyone has any final questions, including Andy. And then I'll share about just briefly about some of our upcoming programming before we close out for today.
I would just say that, Dr. Yen, I really appreciate the time. I do really think that, of course, one of the biggest indicators we have of navigation being successful in screening and prevention is bowel preparation adherence, and really looking at people showing up for colonoscopies, and then the ability to provide a good, adequate, or excellent endoscopy exam. And that is a big hallmark of making sure that the bowel prep. And so I want to remind everybody in terms of those processes is really, again, making sure you're clear with your GI provider about what type of prep. If they're doing the education, you're doing the education, who's dispensing the prep, who's going to do what in terms of education and reminder calls. And, one of the things that we found early on in the program is, we were really looking at the navigation processes. When we're talking about bowel preparation, sometimes really thinking about the patients are clear even well before the colonoscopy, a day or two, not just a day or two, but before, a reminder of shopping for the types of clear liquids that Dr. Yen spoke of, making sure they've had the discussion with their provider about medications, really thinking about, that ride to and from, having someone escort, and then really thinking about what that means for preparation. I mean, we just do these reminder calls the day before the exam, we miss a really strong opportunity to help patients get game ready. And so we provided some materials over the course of the program, and we can probably resurrect those to talk about at each one of those time points, how you can really think about your systems and your workflows to ensure that you're helping provide that level of navigation, outreach, reminder, to make sure that this bowel preparation component has the best option of being successful as possible. Because again, I think throughout the program, we've been able to show stronger bowel prep adequacy, people getting through their exams, showing the value of the work you're doing and those sort of outcomes. So I just want to reiterate that from the process side, there's things for us definitely to consider. And through our navigation manual, which Elsa's put in a lot of time into adapting, we can definitely lead you back to those resources where we have those programmatic materials in place to help think about really getting a plan in place. So I would just add that. And I think Dr. Yen, this has been great to have you here today and share your perspective. So those are my 2 cents. Thanks, Elsa.
Thank you so much, Andy, and thank you very much, Dr. Yen. Before we do our final announcements for closeout, just wanted to see if you had any closing thoughts you wanted to share, but really wanted to thank you for your time, and we'll share Dr. Yen's contact information as well. If any of you on the call today have any follow-up questions that you didn't think of today, but would like to follow up with Dr. Yen about.
Thanks for having me. And thank you to everyone for, it is very important work that you do. I do a bit of colon cancer research, and one of the big things, kind of trends, one of the many things that has resulted as from COVID is that we estimate that because of COVID, that additional wave of the pandemic, will have an additional maybe like 50,000 colon cancers diagnosed in the next 10 years or so. And so that just stresses how important it is, the work that you guys are doing to get these patients in for a good colonoscopy so that we can give them that clean bill of health, and if they do have high risk pathology, so that we can find it earlier and save someone from a surgery and chemo and stuff like that. But thank you for having me.
Thank you very much. We really appreciate your time, and we really appreciate all of the time that each of you navigators spend with your patients to really help set them up for success for this important preventative exam. So I also just wanted to remind everyone that CCSP has our new resource fair meetup series starting next week on Tuesday, February 22nd. And these are short form webinars and workshops where we'll hear on a different topic about some of those exact resources that can be used to support your patients in overcoming barriers that might prevent them from getting into care and their medical appointments. So our first session on Tuesday is focused on food security, and we have Project Angel Heart and Benefits in Action, who will be joining us to share about their organization and their resources, and how navigators can best utilize those resources to share with your patients. So these are going to be quick presentations from these organizations, and then going into a breakout room, which each of them as an opportunity to join them, kind of like a virtual booth to ask your questions, and then exchange information with other participants in the breakout room about the services and resources you're providing to patients. So I will also put that link in the chat for registration. And secondly, I have put in the evaluation of today's webinar in the chat. Please take a moment to complete that. Let us know what you thought of Dr. Yen's presentation, and we'll share that feedback with him as well. And we'll be sharing a copy of Dr. Yen's slides in today's recording as well. So thank you all so much for being here today. And another thank you to Dr. Yen. Have a great day, everyone.
You take care, everyone.